for whatever reason, with no data, the research from open abdominal GI cases got extrapolated broadly. And I remember asking, I was actually in practice a little bit before the broad recommendation. I remember asking this guy, Patch Dellinger, who was involved in these recommendations. It's called like the Antibiotic Society of America, one of these. There's all these niche meetings, we have the Pancreas Club, it's like all these meetings. It's more fun than the Spleen Society, by the way. They're boring. And so I remember asking him, why is it the antibiotic recommendation at the time of incision for every operation? I've never seen or heard of an infection for these minor procedures. And he said, well, we thought a lot about that on our committee, and we decided making it easy to remember to do it for every operation would ensure that the big operations get it. And I thought, well, we may have a blind spot in American medicine. Now it's very obvious to me, based on some research I've been seeing out there, that not only could we be breeding resistance, but what are these antibiotics doing to the gut microbiome? And it turns out that a new theory, which has emerged out of the University of Chicago, is suggesting that surgical infections don't come from the skin bacteria crawling in. It comes from the gut, some sort of weakness in the gut, and there may be a transposition of some bacteria. And they've actually done studies now in mice where they alter their gut microbiome prior to surgery, and they have found that there's some reduction in infections. So there may be sort of probiotics preoperatively that may reduce the risk. This is a big area of ongoing research. There's nothing definitive. We've learned that people should chug a Gatorade 3 to 4 hours before surgery, mostly for the glucose. But what's it doing to the gut? Or is the patient coming in a starvation state, and is that doing something to the microbiome? We've had all this dogma in the operating room. You got to wear your hats, like here, you got to cover your shoes. Some places don't cover your shoes. And then you go overseas, as you may have as well. You go to Africa and you realize they're not wearing anything. They're not even wearing masks when they're doing surgery. And their infection rate is no different.
How, really?
Yeah. Yeah. And that's
surprising to me.
Yeah. And you think, well, what is the mask doing? Is it preventing sweat from dripping in? Is it preventing the airborne particles? Because the airborne particles are just coming out of the side of your mask, right? So there's this University of Chicago research is challenging a lot of deeply held assumptions in operating room protocol. But one of the things I feel bad about, and I don't do it anymore now, is going in for a minor laparoscopic procedure. Anesthesiologist says, "You want me to give Ansef?" And I say, "No, you can hold off."